Hi everyone, my name is Ellie Hultgren and today I am going to be talking about Pica as it pertains to children diagnosed with autism spectrum disorder. So let me get my screen up and we'll go to present. All right, so Pica. What is pica? Pica is defined as the repeated eating and or mouthing of non-food items. And these items can be things such as paper, plants, plastic, stones. It can be a very rare and serious life-threatening disorder when objects are consumed that the body can't necessarily bring through the system, and it often presents itself in individuals with neurological and or developmental disorders. So autism spectrum disorder falls under this category, and it's seen in about 25% of children diagnosed with autism spectrum disorder. But it's also frequently found in individuals with intellectual disability, developmental disability, and schizophrenia. It's considered abnormal when this behavior continues after 18 months of age. Before this 18th month period, it's considered not abnormal because babies and toddlers will often put food and different objects in their mouth as they learn about their environment around them. So some of the diagnostic criteria, the first one is persistent eating of non-nutritive substances. 2, behavior continues for at least 1 month. 3, the behavior is inappropriate for a person's developmental level. And 4, the behavior is not a culturally normative or socially supported practice. So it's not something that's frequently done within an individual's culture. Some of the causes or why this happens, a lot of times children like this sensory feedback. Having these different items in their mouth can bring them a pleasurable or enjoyable feeling. They may have difficulty telling food items from non-food items. There could be genuine cravings for certain nutrients found within the objects, such as iron or zinc. Another important thing to recognize is that it's not typically caused by an effort to get attention or a lack of ability to communicate needs on the child's part. There's usually some other underlying problem going on that we need to find out in order to help them. So some of the signs of pica: putting items such as toys in the mouth, often searching for items to put in the mouth, um, non-food items found within the bowel movement. So when your child goes to the bathroom, you see things such as string, pebbles, plastic, things like that within their bowel movement. Frequent eating from the floor, trash can, or other atypical places, and then difficulty telling the difference between food and non-food items. And again, these aren't the only signs, but these are some of the common signs that are seen with individuals diagnosed with pica. So some of the complications, it's important for me to note that most children with pica are healthy, as most items can pass through the bowels without any complications. But when some of those items like plastic and other hard items begin to get swallowed that can't pass through the bowels, certain complications such as blockages within the intestines can occur, damage to the stomach lining, lead poisoning, cleaning product poisoning, infections in the mouth, stomach, intestines, and then the wearing down of teeth. So it's really important, if you suspect that your child has pica, to watch for these um, areas, because these are the different complications that could occur if the child is consuming things that can't be passed. So as the parent and caregiver, there are some things that you can do to help your child. So one of the most important things is to alert your healthcare providers, because this can allow them to run tests, and then they can maybe find things such as nutritional deficiencies. So then we can take a supplement such as a zinc supplement or iron supplement, so that the child doesn't feel they need to eat these other objects to get those nutrients. And it can also help to identify potential poisonings that need to be treated. It's also important to inform teachers, other caregivers, so that they know what items are frequently put in the mouth, when those certain circumstances happen, so that they can help keep an eye out for those times while they're watching the child. And then pica proof the home. So keep commonly eaten things out of sight, locked away, so that the child can't have access to them. And then vacuum and sweep often to get those things off the floor. You can also enrich the child's environment by providing other activities that they can do with their hands to keep their hands busy. You can teach danger awareness skills such as identifying food items from non-food items. And you could also consider working with a behavior specialist to work on different things such as skill building, redirection, and finding alternative behaviors. So, who can help? So, some professionals who can help are anyone who has experience with pica, such as a psychologist, a behavioral pediatrician, dietitian, other primary care providers. So, I've listed some in the Fargo Moorhead area, and the North Dakota Autism Center is the first one. This would be a good resource to contact, and they can help lead you in the right direction to help on your way to treating this pica. And then another psychologist that I found in the Fargo Moorhead area is Justin Bosek, and he has great history with autism spectrum disorder. So I provided their contact information here. Some of the treatment strategies that you can do, you can block the child's hand. So you put your hand in front of the child's hand to block them from bringing the food to the mouth. Skill building, such as identifying food from non-food items, frequent snack scheduling so that the child is aware that food is coming and that they don't need to resort to these other objects. And then teaching alternative behaviors such as picking up pica items and throwing them away or putting them back to their place and not in the mouth. And if these treatment strategies are not working for you, a specialist must be seen to help with the behaviors that are currently happening. The specialist will likely do a behavioral assessment so that they can identify why these different occurrences are happening. And some of these different strategies that they may use are brief physical restraint, such as holding the child's hands to their sides for a short period of time, and then overcorrection, where they actually help the child pick up the pica item. And both of these are neurological different strategies that will help to decrease the behavior in the end, hopefully. So these are my resources. And then following, there should be an attached of a parent toolkit, which identifies some of the common items that can be eaten as pica items, some strategies you can use. And so this should be attached alongside my presentation. Thank you for your time today. It was nice to talk to you.